Americans for Prosperity, and we're here to talk about what happens when Medicaid grows. I have to share my experience from a previous life when I served here for 12 years, and 2 of those years was on the Health and Human Services Committee. And what happens here is great things and some things that we promise but don't deliver. And when you have a limited budget and you start new programs that are going to grow uncontrollably, someone gets cut short. When you come to the State House, you have a bill from Medicaid that has to be paid. Those are services already rendered, promises made and kept by the medical community. That's a bill that must be paid. That is done before you then decide how much money you can give to the other areas of government that you've promised, including schools, including health care, other parts of Medicaid, including roads and bridges. So today, we're going to bring some faces here to talk about those other areas that will get cut. And I'd like you to picture it like this. You have a finite amount of money, and Mr. Pac-Man is coming through and eating that money as fast as he can. Because the first bucket will go to the bill, the Medicaid bill, services already rendered. You will have no choice. The legislators who serve here will have no choice but to pay that bill and then watch that eat that budget. What's left will then be distributed. And schools, towns, and roads and bridges, and other healthcare areas will be cut. So let me introduce, first of all, Laura Parker. Laura is the selectman on the board of the town of Sidney, and she's going to talk about what this will mean to a town like hers. Thank you. Laura?
Good morning. My name is Laura Parker. As she said, I'm a selectman for the town of Sidney. Today I speak on my own behalf. The question of Medicaid expansion in Maine is one we've been grappling with for some time now. It is difficult to wade through as it does evoke strong emotions on all sides. I feel, however, as in all things brought before the legislature for debate, that emotion and ideologies must be set aside. Dealing with the facts and projections based on reasonable research is what we are left with. The fact is, Maine can't afford an increase in Medicaid spending. The conservative projected increase of 70,000 people to the Medicaid roll in Maine is just an estimate. One could suppose that the real numbers could be lower, but reason tells us that the more likely scenario is the actual figures will come in higher. The federal government has promised to pay 100% of the expansion costs for the first 3 years, dropping yearly thereafter. One cannot discount the fact that we live with a government that is constantly changing representatives. Who is to say that the reimbursement rate won't change or completely disappear before it was promised to? Where the money comes from is a moot point, and one that seems to get buried under the carpet far too often. Whether it comes from the federal government or state government, it is all tax dollars coming out of the pockets of hardworking Americans. As a state, we have not been able to surmise a way to serve the more than 3,000 disabled Mainers who are already waitlisted for the services they need. Yet some would seek to offer insurance to able-bodied childless adults. Where then lies the incentive for these adults to find jobs that provide insurance outside of the aid of government, or for said individuals to utilize the health care options given them by the Affordable Care Act? The exact cost of Medicaid expansion on local municipalities is unclear at this time, but an increase is a certainty if Medicaid expansion is passed in Maine without a significant spending reduction. Currently, towns across the state are building their annual budgets, painstakingly going line by line through salaries, road maintenance, vehicle requirements, and borrowing needs, just to name a few. The weight of additional fiscal responsibility resulting from reallocation of funds to pay for Medicaid expansion is not a burden they should have to bear. I'd like those who support expansion to explain how they will pay for both the expansion and the current level of funding promised to municipalities without raising taxes on a population that is already living in a high-tax state. If the Maine State Legislature cannot devise a way to cut spending and maintain already promised fund allocations to municipalities and expand Medicaid, then the answer is clear. We cannot afford it.
So Pac-Man is doing his job, eating and eating. And we know this historically, and we know it from other states, and we don't want it to happen to Maine. So let me introduce to you Brian Powers. Brian is on the school committee in the town of Hope.
Good morning, and thanks for inviting me. Most of you probably know where Hope is, but if you don't, it's Guerin. It's a small rural community, about 1,500, 1,600 people. But we are distinguished in that we have a superior elementary school. In 2012, it was awarded the National Program School, and only 8% of the schools across the country reach that level of achievement, and it's only 8% in the last 28 years since the program's been going. And in 2013, our school was one of 2 in Maine selected for the National Title I Distinguished School. We've done this by a number of means, not only through funding, but through community and parent involvement. So the solutions for problems that we face as societies are not always solved through funding. We have to involve the people affected by it in the solution, not just throw money at it. The source of funding that we rely on from the state has never been met. They made a commitment to a referendum that was passed in 2004 to fund 55% of the cost of local education and 100% of the cost of special needs education. They haven't met that. They don't have any program in place or intent currently to do that. Yet we're talking about an expansion of a program that causes people to become dependent on some other source for their livelihood, rather than independent, that we're trying to teach the children at Hope to be in the future when they grow up on homes. So we're sort of at odds with the purpose of these 2 programs. On the one hand, we're trying to foster success and independence, and on the other hand, we're trying to teach dependence. One, we're giving a fish; the other one, we're teaching how to fish. That's an old Japanese proverb, but I think the point is still pretty sharp, and it applies in this instance. We can't continue to fund everything out there, and the solution for people in need isn't always money. It's enabling them to take care of themselves. That involves not just money, but communities, parents, nonprofits. There's a lot of different means to do that. The legislature needs to realize that we can't be all things to all people. And the source of the tax dollars is the people. It isn't the federal government, it isn't the state government, it isn't local government. It's Americans. We're all in this boat together. So we don't think this is a very good idea at all. If 10 years down the road, the burden is estimated to be between $80 and $150 million to the taxpayers. That's going to have a tremendous effect on our schools. 70% of every dollar that's raised in Hope goes to education. We've made a substantial commitment. But every year that keeps going up because other sources like state funding goes down. County government costs reflect 8% of the budget, leaving only 12% to take care of local programs like roads and bridges, solid waste disposal. So I think that the state needs to live up to its prior commitments and fund education the way it's supposed to be, and not be entertaining additional programs, which is going to diminish the capacity of them to do that. Thank you very much.
Thank you. I'm going to ask Representative Guerin to come forward. She has a letter that she's going to share from a constituent.
As a legislator one of the things we need to look at is the long-term picture when we consider Medicare expansion and all of the things that will not have funding. Our roads, our schools, retirees, our elderly. One of the issues that has gotten a lot of attention in the press has been the people who are on the wait list. And those, to me, have been just obscure figures of someone that I didn't know, but I certainly understood their plight. This week, I received an email from a woman who was, her son, who has autism, his name is Michael, was in the same Boy Scout troop as my son. And she said, I haven't talked to you for a long time, but I know you're in the legislature, and Michael needs help. And I can't believe that the state is considering expanding Medicaid to healthy people when we can't have help with our autistic son. I am willing to speak to the media. I am willing to speak to anybody who will listen. Can you help me with that? So I told her about the press conference today, and she really had wanted to attend, but she needed to care for Michael. So she wasn't able to come, but she sent a letter. So I'm going to read the letter from her. To members of all political parties and media, my name is Cynthia Levasseur. My husband Paul and I are the parents of 2 adult children. Our son has autism. I just had to quit my job in November 2013. I had exhausted both state and federal Family Medical Leave Acts and vacation time to be home to care for our son. Our son is on the Section 21 and 29 waiting lists, which are averaging out to be many years long. The state of Maine currently has over 4,000 differently abled adults like our son on these wait lists. This situation is putting families like us into financial hardship and, most importantly, jeopardizing any possible chance of independence for these adults with disabilities. How many families in the state of Maine do you know who can survive on one income? Also, it will cost the state more money to care for these adults later if they don't get the immediate access to the Section 21 and 29 programs that will give them the chance to be somewhat independent. How is expanding Medicaid and adding more people to Medicaid program going to help to reduce these wait lists? Does it make sense to me? The state of Maine is denying differently abled adults like our son the same rights as anyone who does not have a disability. I would like for politicians to roll up their sleeves and fix this. Put an end to these Section 21 and 29 wait lists. Ask yourselves, what would you do if this situation applied to your family? We are not statistics or numbers to be used to gain political leverage to justify points of view. We are people. We are families. Let our voices be heard. Cynthia and Paul Levasseur. And she's included her email and phone number if anybody in the media would like to contact her.
Thank you very much. What we're asking is for each legislator to, in the balance, hold all of these stories before they expand, before they create a Medicaid PAC-MAP that will eat the budget and leave these people short. So we thank you for coming this morning, and we look forward to the continued debate as long as this bill is alive. Thank you again.
I have a quick question for is it Mr. Powers from Hope?
Yes.
I assume you're, two answers. First, I assume you're speaking for yourself, not the whole school board.
That's correct.
And is your issue here more philosophical, sort of with the whole idea of dependence, or is it more about not wanting to see a cutback in money from the state for the schools?
Well, it's both.
I understand that, but is it
Is it more one than the other?
Yeah.
It's sort of the chicken and the egg scenario. And,
Brian, you can come right up here. I had to that.
We can't afford it. Okay, we can't. We're struggling. Quite seriously, we're really struggling to maintain services at the current level. And with the increase of requirements that come down from state and federal policies, we're confronted with unanticipated expenses every year. This year alone, I think we had to add 2 special ed techs that are required, as determined by...
Because of new mandates.
Because of the mandates, right. And the teachers and administrators are spending a lot more time in non-teaching activities to try to accommodate all of these special reports and requirements that are handed down by the state and federal government. But the cost is a burden on the community of Hope. I mean, we're a typical Maine community. We have a lot of people who have left the workforce, okay, they're on fixed incomes, and they're having to make some really, really embarrassing decisions when to talk about. It's a matter of dollars, okay, to a lot of these people. So incrementally, we're pushing the very foundation of this community away and rejecting them in order to accommodate the educational needs of the children that are coming along. I mean, everybody has a soft place in their heart for children. I mean, it is the future. And socially, I believe it's the best investment we can make as a society. But it isn't the only investment we need to make. And everything that the state does that's not consciously keeping that in the back of their minds is not a good investment. I mean, this is the long-term solution that we're talking about. The future of these children and their success, and the attitude that the community fosters about being successful and working hard is going to help everybody. So it's again, it's not a stopgap measure like a Medicaid program. It's a long-term investment, and we need to look at it that way. We've gotten into this situation by ignoring it, okay, by saying it's somebody else's problem. Well, it's not somebody else's problem. It's our problem. It's everybody in this room's problem. So it hits home. It really does. I mean, the budget committee struggles. We're struggling. Last year, the only thing that went up in the town of Hope, the only budget item that went up in the town of Hope was education. Everything else stayed the same or went down, was cut. So we're not living up to the expectations for other services like public safety. County taxes go up every year. Solid waste goes up every year. You know what goes up every year. You have to buy things and pay for things just like everybody else. So when the state undertakes a program of this size and this magnitude and continues to dig in this bottomless pit, we're sort of fighting the tide here. So everybody needs to get on the same page here and determine what this long-term solution is. I think it's through education. I don't think it's through creating dependency. I think it's through creating independency. Okay.
Thank you.
Yeah.
Thank you very much.